7 Depression Research Paper Topic Ideas. In psychology classes, it is common for students to write a depression research paper. Researching depression may be beneficial if you have a personal interest in this topic and want to learn more, or if you are simply passionate about this mental health issue. However, since depression is a very complex subject, it offers many possible topics to focus on, which may leave you wondering where to begin. If this is how you feel, here are a few research titles about depression to help inspire your topic choice. You can use these suggestions as actual research titles about depression, or you can use them to lead you to other more in depth topics that you can look into further for your depression research paper. What is depression? Everyone experiences times when they feel a little bit blue or sad. This is a normal part of being human. Depression, however, it is a medical condition that is quite different from everyday moodiness. Your depression research paper may explore the basics, or it might delve deeper into the definition of clinical depression or the difference between clinical depression and sadness. Types of depression. There are several different types of depression that are dependent on how an individual's depression symptoms manifest themselves. Depression symptoms may vary in severity or in what is causing them. For instance, major depressive disorder MDD may have no identifiable cause, while postpartum depression is typically linked to pregnancy and childbirth. Depressive symptoms may also be part of an illness called bipolar disorder. This includes fluctuations between depressive moods and a state of extreme elation called mania. Bipolar disorder is a topic that offers many research opportunities from its definitions and its causes to associated risks, symptoms, and treatment. Causes of depression. The possible causes of depression are many and not yet well understood. However, it most likely results from an interplay of genetic vulnerability and environmental factors. Your depression research paper could explore one or more of these causes and reference that at least research on the topic. For instance, how does an imbalance in brain chemistry or poor nutrition relate to depression? Is there a relationship between the stressful, busy lives of today's society and the rise of depression? How can grief or a major medical condition lead to overwhelming sadness and depression? Who is at risk for depression? This is a good research question about depression, as a certain risk factors may make a person more prone to developing this mental health condition, such as family history of depression, adverse childhood experiences, stress, illness, and gender. This is not a complete list of all risk factors. However, it is good place to start. The growing rate of depression in children, teenagers, and young adults is an interesting subtopic you can focus on as well. Whether you dive into the reasons behind the increase in rates of depression or discuss the treatment opinions that are safe for young people. There is a lot of research available in this area and many unanswered questions to consider. Depression signs and symptoms. The signs of depression are those outward manifestations of the illness that our doctor can observe when they examine our patient. For example, a lack of emotional responsiveness is a visible sign. On the other hand, symptoms are subjective things about the illness that only the patient can observe, such as feelings of guilt or sadness. An illness such as depression is often invisible to the outside observer. That is why it is very important for patients to make an accurate accounting of all of their symptoms so their doctor can diagnose them properly. In your depression research paper, you may explore these invisible symptoms of depression in adults or explore how depression symptoms can be different in children. How is depression diagnosed? This is another good depression research topic because, in some ways, the diagnosis of depression is more of an art than a science. Doctor must generally rely upon the patient's set of symptoms and what they can observe about them during their examination to make a diagnosis. If you would like to pursue this topic, you may want to start with the Diagnostic and Statistical Manual of Mental Disorder. The fifth edition, known as DSM-5, offers a very detailed explanation that guides doctors to a diagnosis. You can also compare the current model of diagnosing depression to the historical method of diagnosis. How have these updates improved the way depression is treated? Treatment opinions for depression. The first choice of depression treatment is generally an antidepressant medication. Selective serotonin uptake inhibitors SSRIs are the most popular choice because they can be quite effective and tend to have fewer side effects than other types of antidepressants. Psychotherapy or talk therapy is another effective and common choice. It is especially efficacious when combined with antidepressant therapy. Certain other treatments, such as convulsive therapy ECT or vagus nerve stimulation VNS, are most commonly used for patients who do not respond to more common forms of treatment. Focusing on one of these treatment is an option for your depression research paper. Comparing and contrasting several different types of treatment can also make a good research title about depression.